Hello everyone, my name is Andrew Karazi, and I'll be doing my presentation on the human papillomavirus. The human papillomavirus is a common sexually transmitted infection that causes genital warts and a variety of cancers, such as cervical, penile, vulvar, vaginal, and anal. The HPV virus is a DNA tumor virus with hundreds of strains. It can be contracted through direct skin contact, usually through sexual activity. HPV can be spread even with the use of sexual protection, as they are not completely protective against the infection. And if one has contracted the disease, they are usually asymptomatic and may spread the infection to other individuals they come in contact with. Where does the human papillomavirus occur? It is not really isolated to a single geographic location, as it is so widespread among the human population, as 8 out of 10 sexually active individuals will contract the disease eventually in their life. The etiological factors of the human papillomavirus sum up to the virus entering the body from an opening in the skin, through skin to skin contact, or through direct contact with genital warts caused by the infection. Various other factors also put individuals at a higher risk of contracting the disease, such as having more than one sexual partner, having a weak immune system, or having damaged skin openings. Many public health programs exist that are currently attempting to reduce the cases of HPV infections with vaccines, and in the process, attempting to eradicate diseases such as cervical cancer caused by the HPV virus. The National Foundation for Infectious Diseases has created a call to action for healthcare providers to educate patients and their parents about the benefits of the HPV vaccine and to encourage immunization at a young age, usually pre-adolescent. A study that caught my eye was done by the Helsinki University Central Hospital and the University of Tampere, Finland. It used a laser therapy to cure lesions caused by the HPV virus, and it was effective in removing the phenotype. However, it was ineffective in directly eradicating the source of the HPV virus. There are ways to reducing the risk of contracting the HPV virus, such as not having more than one sexual partner and having good health, to have a strong immune system, and having damaged skin openings cleaned and sealed. As mentioned earlier, many public health programs exist that are currently attempting to reduce the cases of HPV infections with vaccines, and in the process, attempting to reduce cases of cervical cancer caused by it. The Immunization Action Coalition has created a call to action for healthcare providers to educate patients and their parents about the benefits of the HPV vaccine and to encourage immunization at a young age, usually pre-adolescent, to have them vaccinated before they become sexually active. The National Foundation for Infectious Diseases has goals to increase the number of HPV vaccinations to prevent the spread of the virus and prevent the cancers that are caused by the HPV virus. From my personal standpoint, a large sum of the effort against the spread of the human papillomavirus should be focused on educating adolescent teens about the dangers of it, the various symptoms of it, and preventing being at risk of contracting the disease. If young adults are educated about the potential of suffering from cancers caused by the virus, and that there are immunizations for the virus, I believe the number of people receiving vaccines would increase. From my own experience of health education from high school, the current curriculum teaches students about the symptoms and various issues caused by sexually transmitted diseases, including HPV, and the basics of how to avoid them, ranging from protection and by just avoiding certain activities. Furthermore, I believe it would be beneficial to have public school districts organize vaccinations for students of their schools, similar to how they would have a program for flu vaccinations. It is a taboo subject for some parents because it is mostly sexually contracted disease, but if educational pamphlets are sent home with students with information on the benefits of the vaccine, I believe many parents would want their children to be immunized and protected. Thank you. That concludes my presentation on the human papillomavirus.